is Andy Miller. I'm the Executive Vice President for Mission here at the Lance Armstrong Foundation, and I'm here today with Dr. Craig Nichols, longtime board member of the foundation and a practicing oncologist, as well as Lance's own physician. I'm here today to talk to Craig a little bit about the recent article in the New York Times that talked about the overpromise that cancer screening has resulted in greater benefit than we might actually have been led to believe. So I'll ask Craig, as a physician, what do you think about the message that's been put out there that the benefits of screening, cancer screening specifically, have been exaggerated?
Well, I don't think that I would say that the benefit of screening is zero, and that's one of the messages I would hope that people don't take away. Is screening perfect? Absolutely not. Do we identify cancers that may not have ever come to clinical consequence? Absolutely. But are we reducing the death rate from cancer? Are we finding cancers treatable, and importantly, invasive cancers at an earlier stage? Absolutely. And I think some of the data that they talk about might be reflective of the fact that we aren't screening all our high-risk populations as well. We aren't enriching our screening programs for those at the highest risk, where we do clearly see major benefits. Also, I think it's important to emphasize that much of cancer research and cancer early diagnosis and screening, the advances are incremental. That this is something that has unfolded over many, many years, and that our advances are stepwise. And I think we have made a stepwise advance with screening. I think people, it's way too early for patients to bail on the traditional screening recommendations that have been out there for a long time. But it also speaks to us in the cancer research community and the advocacy communities that we really need much more powerful mechanisms to not only detect cancers early, detect them in high-risk populations, but also be able to sort out those clinically insignificant cancers, which sounds a bit like an oxymoron, versus those that could become invasive and die and lead to patients suffering and death. So there's screening is important. We need to get better at it. It does add value, not as much as we hope that it will in the very near future. But I do think that it is way too early to throw out the baby with the bathwater here, and that even with our current technologies, there is proven value to this in cervical cancer and breast cancer. Prostate cancer is problematic, but there are randomized studies that show now that there is a trend towards decreasing death rates in screened populations. So I think that it's way too early to make a blanket judgment about these things.
So if people are confused about this message and how that would influence their decision to be screened as a physician, what would you say to a patient?
I would say that I would discuss with my physician the risk of screening, the risk of overtreatment. What happens if I find what if an abnormality is found? Are there ways to determine whether or not this needs treatment or not? I would frankly ask your physician if they think it is important. And I would, in most circumstances, I think the bulk of the medical community is strongly behind our current screening technologies, wishing for better and more, wishing they were